There is a reason skin tags frustrate so many people. Because most people treat the skin tag itself instead of the reason it showed up in the first place. They freeze them, burn them, cut them off, cover them with creams. And for a while, they think the problem is gone. Then a few months later, another one appears, maybe on the neck, maybe under the arm, maybe somewhere new. And that is the moment people realize this was never just about the skin. What I want you to understand today is something most people never hear from their doctor. Skin tags are not random. Your body does not suddenly grow extra tissue for no reason. Skin tags are signals. They are clues. They are often one of the earliest visible warnings that your metabolism is under stress. And the dangerous part is this. That stress can exist years before diabetes shows up on a blood test, years before weight gain becomes severe, years before anyone tells you there is a problem. I am Dr. Sean Dozbo, and today I'm going to explain exactly why skin tags happen, why they keep coming back, why some people still struggle with them even after keto or carnivore, and what actually has to change inside the body if you want those skin tags to stop forming naturally. Before we begin, I want you to look at your skin differently, not cosmetically, biologically, because your skin is one of the most honest organs in your body. It reflects inflammation, hormones, blood sugar, stress, sleep quality, insulin levels, and skin tags are one of the clearest signs that something deeper is happening beneath the surface. Now, first, let us talk about what a skin tag actually is. A skin tag is made from normal skin tissue, not cancer, not infection, not poison leaving the body. It is normal skin that switched into overgrowth mode. Usually they are small and soft. They hang from a narrow stalk, almost like a tiny mushroom, sometimes flesh-colored, sometimes darker, sometimes alone, sometimes clustered together. And they almost always show up in areas where friction exists: the neck, the armpits, under the breasts, the groin, anywhere skin constantly rubs against skin. But friction alone is not enough to create them. If it were, every person alive would have dozens of skin tags. The real driver is insulin. And this is the part most people misunderstand. Insulin is not just a blood sugar hormone. It is a growth hormone. Every time insulin rises, it tells cells to grow, store, multiply, hold on to energy. That is useful when insulin rises briefly after eating healthy food. But modern diets keep insulin elevated almost constantly. Breakfast spikes it, snacks spike it, juice spikes it, bread spikes it, cereal spikes it, pasta spikes it, sugary coffee spikes it. And over years, the body adapts by producing more and more insulin just to keep blood sugar under control. This is called insulin resistance. Now, here is the dangerous part. You can have insulin resistance long before diabetes, long before obesity, long before abnormal glucose labs. Some people walking around with normal blood sugar already have extremely high insulin levels. Their body is compensating, working overtime, keeping glucose normal temporarily while insulin quietly rises in the background. And while that is happening, insulin is stimulating tissue growth everywhere. Fat cells grow, inflammation grows, liver fat grows, and skin cells start growing faster too, especially in areas with friction. That is how skin tags form. Tiny areas of skin responding to repeated growth signals over and over and over again. Now, I know some people say, but Dr. Sean, I am not overweight. I am not diabetic. My labs are normal. That does not rule out insulin resistance. I have seen thin patients with severe insulin resistance. I have seen patients with completely normal glucose who still had fatty liver and dozens of skin tags. The body can hide metabolic disease for years before standard testing catches it. And this is why skin tags matter. They are visible evidence that something hormonal may already be happening. One study found that the overwhelming majority of patients with skin tags also had metabolic problems connected to insulin resistance, high blood pressure, diabetes, obesity, abnormal cholesterol. And the more metabolic problems present, the more skin tags tended to appear. That is not coincidence. Now let us talk about the comment I hear constantly. I went keto, I went carnivore, I cut carbs. Why are my skin tags still here? Very important question, because lowering carbs helps insulin, but advanced insulin resistance takes time to reverse. Some people spent 10 years damaging their metabolism before changing anything. The body does not always undo that in 6 weeks. Sometimes insulin stays elevated longer than expected, especially if these problems are still present. Chronic stress, poor sleep, sleep apnea, constant snacking, late night eating, hidden carbs, artificial sweeteners in some people, alcohol, inflammation, lack of movement, and one of the biggest hidden drivers is cortisol. Cortisol is your stress hormone. Without cortisol, humans would not survive danger. If a threat appears, cortisol raises blood sugar rapidly, so the body has emergency fuel. The problem today is that modern stress never shuts off. Bills, news, poor sleep, financial pressure, relationship stress, constant stimulation. Your brain interprets all of it as survival danger, so cortisol keeps telling the liver to release sugar into the bloodstream. That sugar then requires more insulin, even if you are eating low carb. This is why some people plateau. Their food improved, but their stress hormones never did. And then comes sleep. Sleep is where insulin sensitivity repairs itself. At night, healthy insulin levels should fall. Blood sugar should stabilize, inflammation should calm down, growth hormones should rise, repair should happen. But if sleep is poor, the entire system gets disrupted. And sleep apnea is one of the worst metabolic destroyers I see. People stop breathing dozens of times per hour without realizing it. Oxygen drops, stress hormones surge, blood sugar rises overnight, insulin rises with it. Then they wake up exhausted and wonder why nothing is improving. I have seen patients lose skin tags naturally after finally treating sleep apnea, not because of magic, because the hormonal chaos finally calmed down. Now let us talk practical steps. If you want your body to stop creating skin tags, you must lower insulin consistently long enough for the body to repair. That starts with food. Remove the foods driving insulin spikes. Sugary drinks, juice, candy, bread, pasta, breakfast cereal, processed snacks, frequent grazing throughout the day. Focus on real protein, eggs, meat, fish, healthy fats, non-starchy vegetables, and stop constantly snacking. Every time you eat, insulin rises again. Even small snacks matter. Give your body periods where insulin can finally fall. Now, here is something else I recommend. Track your morning glucose, not randomly during the day. Morning fasting glucose, before food, before coffee, before anything. If your morning glucose is consistently over 100, your insulin is likely elevated too. That matters, because I often see skin tags begin improving when fasting glucose settles into the 80s consistently for several months. Another useful marker is A1C. Many labs say anything under 5.7 is normal, but metabolically healthy and statistically normal are not always the same thing. I personally like seeing A1C closer to 5.0 to 5.3 in patients improving insulin resistance. Now, I also want to say something important. Skin tags do not disappear overnight. Some shrink slowly, some dry out, some darken before falling off, some stop growing while new ones stop appearing first. Healing is gradual. But the bigger goal is not cosmetic. The bigger goal is metabolic recovery, because if insulin is high enough to grow skin tags, it is also affecting your arteries, your liver, your pancreas, your brain. The skin tags are simply the visible part. And this is where most people make a mistake. They focus entirely on removing the tag instead of fixing the environment that created it. That is like cutting weeds without touching the roots. Now, does every single skin tag automatically mean disaster? No. But I believe they deserve attention, especially if they are increasing, especially if they appeared alongside weight gain, fatigue, high blood pressure, prediabetes, poor sleep, or belly fat. Your body is communicating. The goal is not fear. The goal is awareness. And honestly, this should encourage you, because many people think declining health appears suddenly one day. It usually does not. The body whispers long before it screams. Skin tags are one of those whispers. And if you listen early enough, you can change direction before serious disease develops. That is the hopeful part of this conversation. Your metabolism can improve, insulin resistance can improve, inflammation can improve, energy can improve. The body is remarkably responsive when you finally remove the signals damaging it every single day. So here is what I want you to do starting now. Look at your skin tags differently, not with embarrassment, not with frustration. Look at them as information. Then ask better questions. How often am I spiking insulin? How is my sleep? How stressed am I? How often am I eating processed carbohydrates? What is my fasting glucose? What is my A1C? Because once you fix the internal environment, the body often stops creating the problem externally. And that changes everything. If this helped you, make sure you subscribe to the channel. And in the comments, tell me something honestly. How long have you had your skin tags? And did anyone ever explain the insulin connection to you before today?